Good afternoon, cadets. It's the third lesson in our first aid series. I'm Lieutenant Colonel Baker, and it's called Severe Emergencies. The first one is how to recognize a first aid emergency. Second one is common injuries, and now we're on the third one, severe injuries. And you can tell by some of these pictures here that there is some severe injuries that are going on. Okay? As always, by North Carolina state law, we have the essential question. How can you respond to severe emergencies? And we've all been either close to a severe emergency or maybe you've been in a severe emergency, okay? Just think about that. Think about the times that you've witnessed that, or maybe it was you that actually got severely injured, okay? So think about what things take 4 minutes to do. I mean, if you do a quick Google search on what things take 4 minutes. Okay. So, I just did a quick search here, and it says, of course, Z-scaler says no. Okay, you can do 4 minutes of push-ups. Okay, you can actually give a good speech. Just do a quick search on what 4 minutes, on what takes 4 minutes, not longer, not less. Okay. And you might be wondering, why is it 4 minutes? Okay. Well, if you think about it, if your brain is without oxygen for 4 minutes, you're clinically dead. Okay. That is one of the reasons why. Okay. So you have 4 minutes is like call it the golden 4 minutes. Okay. You've got to get help by then, get the oxygen flowing back into the brain. Okay, that's why CPR is so important. Okay. Now, did 4 minutes seem like a long time? Just sit there and sit there for 4 minutes and do nothing, and it seems like an extremely long time. Okay, but if somebody is suffering from a heart attack or a stroke or a amputated limb or something like that, 4 minutes does not seem like a long time at all, because you're constantly running around trying to help that person with their injury. Okay. Okay, so if you started to choke on some food and you were alone, what should you do? That's right. You need to lean forward on the railing or a chair and thrust yourself down until you dislodge the obstruction. By the way, I remember President Bush, the first Bush, choking on a pretzel during a State Department dinner. It was all over the news. So it can happen on a small piece of food that you're not aware of. Okay, usually it's a piece of meat or something. All right, so here's our learning objectives. Okay, so here are some of the key words that I'm going to define. Okay, so stroke is a medical emergency where the blood flow to your brain stops completely. Okay? Cardiopulmonary resuscitation is a procedure that is used when someone is unconscious due to a heart attack, stroke, or some other medical emergency. Okay? Here we have automatic external defibrillator, the device that analyzes the heart and determines if an electric shock is needed. We have one here in our hallway at our building. But you guys didn't know. Next time you come in, take a look and you'll see it up there. Okay. Cardiac arrest. Okay, that's a heart attack. The heart stops beating. My brother-in-law, who's 6 months older than me, just suffered a massive heart attack. All of his arteries were blocked from eating poorly for years and not exercising and taking care of himself. Okay. The circulatory system. In the body, the network responsible for the flow of blood, nutrients, hormones, oxygen, and other gases to and from cells. Okay. Okay, so remember, there are the first three things to check for in an injured person. These are the same ones that we discussed in the other two lessons. Check for consciousness, check for breathing and a pulse, and check for uncontrolled bleeding. Okay? Always, those are the first three things you should do when you arrive upon a scene. Okay? So, the symptoms are cool, pale, clammy skin, and enlarged pupils staring off into space. What is the emergency? That's right, you guessed it. It's a shock, okay? The symptoms are paralysis on one side and dizziness. What is the emergency? You guessed it, stroke. Okay? And the symptoms are nausea, indigestion, and pain in the arm and neck. What is the emergency? The heart attack. Okay. All right, going over it again. These are the three things you should check for in an injured person. Check for consciousness, breathing and a pulse, and uncontrolled bleeding. Okay. Very important that you remember those three things. Okay. So signs of choking or emergency. You'll notice they are unable to talk. Okay, they can't say anything. They grab their neck, and they're indicating that there's something wrong in their throat. Okay, problems breathing or noisy breathing. If something's obstructing it, okay, they can't cough. You notice that their skin starts to darken and look blue because they're losing oxygen, and then the loss of consciousness. So remember, if the person can speak or cough, it's not a choking emergency. Okay? So, I mean, there's more than 4,600 people die from choking every year. Okay? Choking occurs when a person's airway becomes blocked by a piece of food or some other object. It prevents the oxygen from getting to the lungs and the brain. So 4,600 people die every year of choking. And this is something that you should know how to take care of it yourself if you're by yourself, or you know how to help somebody that's in need, who's suffering from choking. Okay? So remember, a choking person needs immediate help to clear that airway, to get the air going back into it. So you administer back blows. Okay, you stand at the person's side and have them bend forward. You lean that person forward and give 5 back blows with the heel of your hand in between the shoulder blades. Okay, and you're attempting to dislodge the obstruction in the airway. Okay, if the 5 of the back blows didn't give it out, then you switch to the abdominal thrust, which is what they're shown here. Okay, you stand behind the person and you use one hand to find the person's navel. You make a fist with your other hand and place the thumb side against the middle of the abdomen, slightly above the navel. You grasp the fist with the other hand and press hard into the abdomen with a quick upward thrust, as if trying to lift the person up. You perform 5 of these thrusts if needed. Okay, and each thrust is an attempt to get that object out of the airway. Okay, now, if a child is 1 year old, is choking, use abdominal thrusts only. Do not use back blows. So a little story. 2 months ago, my 1-year-old grandson had his first birthday party, and he started choking on a hot dog. And I had to do the abdominal thrusts on my grandson. Okay, so very scary indeed. Wasn't expecting to even think about it, because we were all having fun watching him eat his cake and run around. So it can happen at any point in time. You just need to be ready, okay? Always be ready, okay? These are exactly what I just went over on the back blows and how you do it. Remember, the magic number is 5 back blows, okay? If that doesn't work, then you need to switch to 5 thrusts, okay? And here, the same thing that I just went over, okay? Let me go to the choking video now.
With an obstructed airway cannot talk or cough. Ask if the person can breathe. Grab around at the waist. Forcefully thrust upward repeatedly. If the person collapses, call 911 and begin CPR.
Okay, so here you see if you're by yourself and then there's no one around and you start choking, okay? You can perform these thrusts on yourself. You notice the individual is leaning against a chair and the chair is in the abdomen and he's thrusting it, okay? Make a fist and position it slightly above your navel. Grasp your fist with your other hand and thrust inward and upward into your abdomen until you get that object out of your airway. Or you can do exactly, if you have a chair, then you lean over and do the same thing. Okay, very important. Now, severe bleeding. Okay, this can happen in a heartbeat. So most of the time, it happens when we're not ready. We're doing something and we're not even thinking about somebody having severe bleeding with an accident. Okay, I mean, it could be a car accident, it could be a household mishap. Okay, those are some of the 2 common sources for severe bleeding accidents. Okay, now remember, the first goal of first aid for severe bleeding is you got to stop the blood loss as soon as possible. Okay, if you lose a certain amount of blood, you can die from it. So you have to stop the bleeding. Okay. Remember, if you're helping a bleeding victim, you got to use those protective gloves that we talked about, that personal protective equipment that should be in your first aid kit, in your car, or at your home. Okay, always have those gloves. Okay. Now remember, always, 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 always call 911. Okay. Before you even start anything, you get those people on the way while you try to administer first aid. Okay. If possible, you need to remove any obvious dirt or objects from the wound. Okay. But do not attempt to remove any of those large objects that are deeply embedded in that wound, because you'll make it worse. Okay. And stop the bleeding. You got to place, a clean cloth on the wound and press it with your hand to control the bleeding. You need that pressure, okay, from your hand. You got to keep the pressure on the wound, and then you need to tightly wrap another piece of cloth around the injury. Okay, use your hands if nothing else is available. Okay, if possible, you need to raise the injured part above the level of the heart to slow down that bleeding. Okay. And in it, you need to help the injured person lie down if possible. Okay. The person should lie on a rug or a blanket to conserve body heat if it's cold, and keep the injured part of the body immobilized, and do not move it again. Okay. Do not. All right. Let's go on to the hands-on here.
If you see an adult suddenly collapse, it's important to act fast. Just use hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Hold the left hand of the victim with the hand on the forehead and center of the chest, and bring the other hand to the fingers. Then push the hand hands to the center of the chest until it clears. It's important to push it bigger than your leg needs to
Okay, so by North Carolina state law, every high schooler has to know CPR before they can graduate. You notice they only said hands only CPR. Okay, that is exactly what it talks about. Your hands are providing that compression on the chest. Okay, nothing else. All right. Okay, you place the heel of one hand on the breastbone right between the nipples. Okay, you place your other heel of your hand on top of that first hand, and you position your body directly over your hands and give 30 chest compressions. These compressions should be fast and hard. Press down about 2 inches into the chest. Each time, let the chest rise completely. Count the compressions quickly, faster than you would count seconds. If you do it correctly, you'll have about 100 compressions in 1 minute. Okay? Give compressions until the victim revives or medical assistance arrives. Okay? Now, obviously, they mentioned it before you do any of that hands-only CPR, you got to call 911. Okay? But there's a warning. If the person has normal breathing, coughing, or movement, do not begin chest compressions. Doing so may cause the heart to stop beating. The chest compression procedure for children and infants is not the same as for adults. The hand position and how hard you press on the chest are the key differences. Do not use the same procedure as you would for an adult. Right. And we do have the automated external defibrillators, or AEDs. We have one out in the hallway. Next time you come into class, take a look at it, okay? I know that Sergeant Corbett, during his CERT training and CPR training, we have simulated AEDs on how to use them. Excuse me. Okay, emergency medical technicians treat victims of sudden cardiac arrest, heart attack, with an automated external defibrillator. An AED is a device that uses a computer chip to analyze the heart rhythm and determines whether an electric shock is needed. An electric shock can restart a heart that has stopped beating. This device saves lives. Because of the ease of operation, people can be trained in AED use in a few hours or less. Okay. The AED uses voice prompts on what to do, which is fantastic. Okay. So here are some of the signs of the heart attack. Okay. I know one of the things that had a boss who suffered from severe indigestion, didn't think anything of it, but found out it was a heart attack. Okay. He had a couple arteries that were 100% clogged. The guy was in shape. He was a colonel, full bird colonel. I'll never forget that. Okay. So it can happen, whether, you got to be prepared for it. Okay, so here's your response that you want to do for the heart attack, right? You always want to call 911, get them out there, and then you can go and administer whatever first aid that you can to those victims, okay? CPR, or hands-only CPR. You'll notice that the CPR, you have that mouth protector and you're going to breathe in, and it's a lot more in depth than only hands-only CPR, okay? And then use an AED if we have one. Well, we do have one here, so that's good. Okay, now let's move on to shock. Okay, shock is a life-threatening condition in which the circulatory system fails to deliver enough blood to vital tissues and organs. A person can go into shock when they suffer an injury, burn, severe infection, heat illness, poisoning, blood loss, broken bones, and heart attack. Shock is a serious condition and causes death if the victim does not receive medical treatment. Okay, now you see the signs of the shock: skin that is cool, clammy, and pale. Right? When you see somebody in shock and you think, their skin doesn't look pale and clammy, it does, okay? The slow, shallow breathing, okay? This feeling weak, faint, confused, and anxious. Okay, some of these symptoms, though, mirror other things, so you really have to assess the situation properly before you administer the right first aid to it, okay? And as always, help for shock, number one thing is what? You got to call 911, okay? That's why we drill that 911 into you, okay? But remember, you begin CPR if the person shows no signs of life, such as breathing, coughing, or movement. You don't want to give CPR if they're breathing, coughing, and movement because you might make things worse, okay? And we discussed that a little bit in the previous slides, okay? Always want to loosen that tight clothing. I know in the Army, they always have us cut this stuff off. But remember in that first aid kit, you got those scissors. That's the reason why you have them in there. Not just to cut the tape, but also to cut clothing off and to loosen it for somebody who's suffering from a life emergency, okay? Don't ever give them anything to drink, no matter how thirsty they say they are. Okay? You don't want to do that. Okay, now, if they bleed from the mouth or they throw up, you got to roll them on the side and let them do that so they don't choke to death from that. Unless you know that they've suffered a severe neck or back injury, you can't move them at all. Okay. Stroke. My mother-in-law had a stroke sitting down right next to me on the couch. I'll never forget that day, okay? All of a sudden, half the side of her face was paralyzed and she couldn't form a sentence. Okay, she couldn't see. She slurred her speech. All these signs. I took her to the hospital because it was quicker for me to do that than to call 911 and get an ambulance there because time was needed and the hospital was only 5 minutes away. So I didn't think it would take that long. Obviously it didn't, and things worked out, okay? But remember, and you see how it says minutes matter, okay? That is why I took my mother-in-law myself, okay? Couldn't risk it because I knew that the further loss of blood would cause severe damage, okay? It tells you to look at the clock and note the exact time you first notice symptoms. That one's hard to do because your loved one is suffering from something that's going on. You're not thinking about the time. So you really have to train yourself to do that, okay? And then stay with the person, okay? Be with them, lay down on the side with them if it's outside. Okay, you got to watch for signs of dangers if they lose consciousness. If they do, then you need to give CPR, okay? And always 911, you see that, okay? Minutes matter. Minutes matter on this, okay? All right, so if you entered a room and saw this scene, what would you think is happening? That's right, he's choking and trying to dislodge the obstruction. Okay? If a person's leg is bleeding severely, you should have them lay down and put a pillow under their leg. I like that. Have them stand up. Yeah, stand up. True or false? In hands-only CPR, you perform 30 chest compressions in 100 seconds. Okay, that's false. You remember? It's reverse, actually. Okay, true or false? If you think someone is having a heart attack but is breathing normally and responsive in every other way, you should perform CPR or hands-only CPR. Okay, remember that's false. You don't want to cause any further damage. Okay. Untrained bystanders can perform the hands-only CPR and use that automated external defibrillator or AED. If someone is not breathing for about, what's the magic number? 4 minutes, they will have brain damage. Brain cells deprived of oxygen begin to die after that time. That's why it's important to get help before those 4 minutes are up. All right, so here we have some activities that need to be completed. Okay. I will load this on this will be the homework for you to do. and it'll be loaded up on the Google Classroom. I'm just giving you a quick view of what it looks like. Okay. And then here's some questions that you ask yourself. Would you like to be certified in CPR? Well, you guys are going to get certified. You don't have a choice unless you don't want to graduate from high school. Okay. And trained to use AED. So the CERT training that Sergeant First Class Corbett gives goes in depth in CPR and the AED and all kinds of other stuff. It's really good. Okay. Okay, so think about it, how to remember the signs and responses to severe emergencies. Okay. And here's the performance assessment task that you're going to need to complete for your homework for that assignment. And as always, I will post that too on the classroom, so you get an email saying, hey, it's there and you need to complete it. Okay. So which picture shows an automated external defibrillator? That's right. See, you can see it right there. Okay. A cardiac arrest is a stoppage of the heart. Cardiopulmonary resuscitation is a procedure that is used when someone is unconscious due to a heart attack, stroke, or some other medical emergency. Remember, unconscious. Okay. The circulatory system is the body's network that is responsible for the flow of blood, nutrients, hormones, oxygen, and other gases to and from cells. Okay. In a stroke, the blood flow to your brain stops. And we go back. So how can you respond to severe emergencies? Hopefully, you guys have learned something here that you can take and you can be better prepared in case an emergency situation happens to you. Thank you for your time.